Labral tears occur when the tissue around the head of the femur, which suctions the joint into the acetabulum, becomes compromised. A labrum works very much like a gasket. It seals the articulation inside of the joint capsule to keep a fluid and healthy relationship in joint mobility. Anytime this labrum is compromised, especially in any legitimate sort of way, it will create a series of symptoms that will continue to increase until surgical intervention is approached. Now, this pain isn't typically debilitating. There are certain movements that seem to uh, allude to higher risks in labral tears, such as repetitive pivoting or repetitive hip flexion, which can be anything from running to soccer to hockey, football, dance. I mean, this is just a huge community of movers that are excessively accessing hip flexion and pivoting motions. The symptoms seem to be of gradual onset, so they will be minimal and get worse over time. As far as pain is concerned, there's usually a combination of dull and sharp growing pain, so on the inside of the upper thigh, and it will occasionally spill out into the hip region, into the glutes. Things like walking, general activity, even prolonged sitting, things like that. And in fact, to talk about sitting, one thing that is prevalent with labral tears is sitting to standing. When you're sitting down, or you have a client complaining of when they're sitting down and they go to stand, they get a catch or a hiccup in their joint where it feels like something's about to tear or go. That is usually a big sign. They'll fail what's called an FAI test, a femoroacetabular impingement test, which is flexion, adduction, internal rotation. If they're positive for that, that would suggest impingement, but impingement typically leads under those exercise situations we talked about before to labral tears, and that is one of the big differentiating factors, is sitting to standing creating a catch or something like that. If confirmed, it must be done through an MRA or an MRI. Contrast enhanced CTs can also show some specificity with this, and surgical intervention in the case of a positive labral tear would be advised.